We head now to Kumasi because the Community Teaching Hospital has appealed for support to begin a life-saving medication for children requiring dialysis treatment. Already, kidney transplant is available on a limited scale nationwide as children benefit from prenatal dialysis for acute kidney injury without any rescue intervention for those with end-stage renal failure. Management of the Community Teaching Hospital has disclosed their readiness to provide the services upon receiving support from stakeholders. Nanabuachi Yadum has more in the following report.
The biggest challenge facing dialysis services in Ghana is affordability. The National Health Insurance Scheme does not cover chronic dialysis services. As a result, accessibility to these services is pocket-driven by clients with a continuous hike in the cost of treatment. The Comfanochi Teaching Hospital, realizing the gravity of the situation, is ready to begin the treatment of dialysis for children. Professor Ochre Ademensa is the CEO of the hospital.
I told you that we had 1.5 dialysis machines at a time. Today we have 4 dialysis machines. The hospital itself, using its IGF, has procured 3 brand new dialysis machines. We are waiting for them. There's a company that is giving us 2 brand new dialysis machines. We are also waiting. We are hoping that by the end of this month we would have about 12 dialysis machines running. One major thing we are looking at is dialysis for children. As it is, it appears that dialysis for children does not exist. Usually you do not have dialysis going on for children. And so it's one area we are looking at to give children the opportunity to live, irrespective of the fact that they may have developed end-stage renal failure.
Professor Ochre Ademensa says the hospital is seeking support from stakeholders to purchase machines for such treatments.
When the issues of dialysis came up and Kolebu was in the news in respect of price changes and all that, I remember in our discussion, if I remember correctly, that I made the point that we buy from the same source, the same supplier, consumables and all that. And so there's a need for us to also push our prices up. But Kolebu took that step. And subsequently, I think that the Fees and Charges Committee of Parliament have sat and reviewed the fees. But Kolebu are lucky to have, this is the first care group, subsidizing the payment for dialysis for patients. We don't have that. But it is understandable to an extent because about 80% of the dialysis cases go to Kolebu. And in large part was because we didn't have a lot of dialysis machines here at our end. I'm sure that when we get to 12, we are in talks with philanthropists, non-governmental organizations, corporate societies to come in and help.
Meanwhile, the Asante Hinotumfose Tutu II made a donation of food supplies to the hospital as part of his 25th anniversary celebration. The intervention is to ensure enough food for patients in the hospital.
In total, 1,240 packs of food were distributed to the various hospitals in the metropolis. So Tafo Government Hospital, Menchia Government Hospital, Kumasi South Government Hospital, which is a regional hospital, MCH Hospital, and then of course Comfanochi Teaching Hospital. A total of 700 packs came to Comfanochi. I was super excited and thrilled when I was told that the King, as part of the 25th anniversary celebrations, and most importantly, the big Akwesi there, wanted to dine with the inmates of the hospital on that Sunday.
Management acknowledged the gesture made by the Asante as a call for more of such interventions.
I want to pray for the King that God continues to endow him with wisdom, with good health, direction, the love for development so far as his kingdom is concerned. I pray that God himself will preserve him and grant us the opportunity to get closer and closer so that we are able to learn from him.
For Joe News, Nanabuachi Yadum, Kumasi.